Hey, my name is Luke Schellenberger. I'm an ENT doc. So patients come in all the time and see us with sinus problems and allergy issues and nasal congestion and all sorts of problems with the nose. And a very common home remedy is what's called nasal saline irrigations. I think it's kind of like giving your nose a bath. It is using a simple saltwater rinse that you put in your nose. And you can use nasal saline sprays, but really it's the irrigation, it's the higher volume irrigation that makes the saline rinse so much more effective. A lot of patients ask, how much do I put in? Well, it's real easy to buy the over-the-counter saline irrigation kits. Neilmed is a very common one, but you can find them at any pharmacy at a couple of different brands. And they come with their own packets, and it's super simple. You put in the water, you put in the packet, mix it up, and you wash your nose out with it. I typically recommend about 120 milliliters. It's about a quarter of a cup on each side once a day. You can do it up to twice a day. You can do it more than that, but usually patients will do it once a day, like in the morning time. It's important to do it before you use any like steroid sprays like Flonase, because you don't want to put the Flonase in there and rinse it out. You do it before the Flonase. It doesn't matter really how it gets in your nose. Patients a lot of times ask, can I use a neti pot? Or should I use these bulb irrigation kits? Or a Navage. Navage is a powered rinser. It really doesn't matter. It's just the higher volume rinsing up into there. Sometimes patients ask, well, I put it up in there and it doesn't go out the other side. That's not that big of a deal. It's really just kind of getting it up in there. It doesn't have to go all the way up into the nasopharynx and back out the other side. It may be helpful if it does, and I'll have a video on how it is actually performed, but the main thing is higher volume and just consistent use. If you're, it's again, it's like taking a bath. If patients are having a lot of sinus and allergy issues, it can make a big difference. That said, it's not magic. I've had patients come in saying, I tried it and I didn't like it. Now, if you try it once and don't like it, that's not really trying it. But if you try it for a week or two and like, my symptoms aren't any better, don't keep doing something that's not working. But I will say that research has shown that patients who do it consistently really will notice that their symptoms are much better. It's not 100% of a guarantee, but I would at least try it for a week before giving up on it. And again, we'll talk some about the techniques of how it's done, what to do, what not to do, in another video. And I'll also have another video on how to make your own irrigation, because it's pretty simple. It's just water, salt water, and occasionally a little baking soda. We'll talk about that another time.